from the Penn Libraries.
My name is Ann Seymour, and I'm currently the Associate Director for the Biomedical Library here at Penn. And in this role, I got to learn about some of the global health work that is done by faculty and students at Penn. And one of the major partnerships that Penn has is in Botswana with the government of Botswana and with the University of Botswana. And I became aware of the work that was being done, in particular by clinicians going to Botswana to help deliver drug therapy and treatment protocols. And because Botswana had the highest HIV rate in the world at one point, it's come down now, fortunately. But so a lot of Penn faculty and clinicians were going there, and I learned that they were expanding the program and that there might be an opportunity for work for libraries and information and providing health information both to clinicians and to patients. So I worked with the director of the Botswana UPenn Partnership, Dr. Harvey Friedman, and we expressed interest in a grant from the Elsevier Foundation under their Innovative Libraries in Developing Countries. And along with Penn colleagues, we applied for a grant to do an information needs assessment to look at the needs, medical information needs in the country. And it was a really kind of perfect time for this because Penn's program was expanding. The country needed expertise, both informatics expertise, and they were launching their first medical school in the country, and which matriculated its first students in August of 2009. And so we were successfully funded. We went to explore what the medical information needs were and interviewed, had many interviews with government, with educators, with librarians, with clinicians, with practitioners in Botswana, with Penn clinicians going to Botswana. And from that report, we made some recommendations, one of which we recognized the role that mobile technology and portable technology could play in the country with delivery of information. And with that in mind, I connected with someone who's kind of a rock star with mobile telemedicine and telemedicine in general and working in developing countries, and that's Dr. Kari Kovarik, who now heads up mobile telemedicine and she's a dermatologist and does mobile telemedicine in the U.S., in underserved communities, and also around the world, but focusing in developing countries, and has a big program in Botswana. And so we connected and we started a pilot with information delivery on mobile devices, and it just kind of expanded, and now that was taken over by the University of Botswana, and they have grew from a small pilot project to distributing tablets to all medical students in their program and to residents. And so it was really exciting to see how, a small partnership could grow into something big, and it was taken over by the University of Botswana School of Medicine. So it was a great example of where we could jumpstart something, but see it see a sustainable program develop out of it. And that's been true with some of the other mobile telemedicine, the more clinical care projects that Dr. Kovarik has overseen. And so we've gotten involved in a lot of different ways, working closely with the library there. We, under some of our funding from Elsevier Foundation, we were able to match funding from the University of Botswana School of Medicine to bring a librarian here for 6 months, Dineo Kitshogaling, and She spent 6 months with us, and I always say she became one of the few medical librarians, if all, the one medical librarian in Botswana. But now she's gotten involved at all levels in the health sciences with our mobile projects, and she recently was able to successfully justify and then recruit 4 new librarians, medical librarians, to serve in the clinical settings that the university will have students and residents at. So very exciting, and now she and I have been working on this health informatics curriculum that's being introduced in the health sciences at the University of Botswana. It's really exciting. And so it kind of grew an avalanche from this seed money from Elsevier Foundation and the work of colleagues here at Penn, in the Penn libraries and outside the libraries. And then we were able to take what we learned there and apply for funding again to do something similar in Guatemala and work with our partner institutions in Guatemala and work with the Guatemala Penn Partnership and with faculty and students and staff involved there, and been doing similar things, but with different approaches because it's a very different place and they have resources in some areas that, for instance, Botswana doesn't, but then they're under-resourced in other areas. And so we've been working closely to help train librarians there and to help build research capacity in Guatemala. So, and I just think the opportunities are endless. I had a meeting yesterday to talk about how we can expand from, small pilots and grow the program out. And so I think there's opportunities, especially in the global health area and working with mobile technology to, go into a lot more countries than just Botswana and Guatemala. But that's been a great start.